Welcome and good morning, everyone, to our third digital health talk on DiGA, a company's journey on health apps on prescription. Not so very German today. We're actually 3 minutes late, but I think that might be excused. I'm very happy to welcome you all in your offices or maybe even at home like I'm today. Our talk series, Digital Health Talks, aims to connect the digital health scene in Hanover, firstly amongst each other, but also abroad. So this is the reason that we speak English. And today we also have an international guest with us, which makes it even more important that we do. My name is Cornelia Körber, and I'm project director at Hanover Impulse. Hanover Impulse is the economic development agency of Hanover and its region. Our topic today, DiGA, has been discussed in Germany and I think outside of Germany all around the last year. It is the big approach to have digital health apps able to be reimbursed by the statutory health insurances. And therefore, I'm very happy to have two guests with us who can discuss this topic from their point of view. Catherine Heuch from Norway, big welcome to you.
Thank you. Hello, Cornelia.
Catherine actually is CEO of a startup company called Nordic Brain Tech, and they're developing a digital health treatment, migraine app, combined with a biofeedback sensor. And Catherine will let us know all about it afterwards. And of course, she's very interested in finding out about what she can do with DiGA. Then we have with us Diana Heinrichs. And Diana Heinrichs is based in Berlin, Germany. And she actually is CEO of a digital health company called Lindera. As such, she has made all her experiences what it takes to be in the whole application process. And on top of it, she's member of the top association of digital health in Germany. So she can let us and also Catherine know what we need to look out for and what we need to consider. Catherine, jumping directly into the topic, you are developing a digital health technology. Can you let us know a little about your product?
Yeah, sure. So first of all, thank you very much for having me here today. I'll introduce myself briefly and Nordic Brain Tech. So I am the CEO of Nordic Brain Tech, and we are an Oslo-based startup with origin from the Norwegian University of Science and Technology. We founded the company 2 years ago. So we develop easy-to-use and scientifically proven technology to help people predict and prevent brain disorders. Our first product is a digital migraine treatment. And I'm not sure if you know, but migraine affects 14% of the world population. There is really a lack of good treatments today. Actually, 80% they discontinue drugs after only 1 year due to the negative side effects and lack of effect. So we provide a digital treatment that uses sensors, body sensors to measure bodily parameters, and a smartphone app. And we use a principle called biofeedback, as you mentioned, Cornelia, which helps you to train your autonomic nerve system. And in this way, we can actually train you to not get a migraine. I have the sensors with me here today, if you can see on the screen. It is a sensor measuring finger temperature and heart rate, and the muscle sensor, muscle tension sensor on your neck. So we aim to provide this treatment to everyone who needs it, making it affordable and available. And Germany is a very interesting market for us, and DiGA is one possible way into the market.
Now, directly having the keyword DiGA. Diana, you are a big expert all around us, or all around DiGA. Could you let us, and of course the audience, know what actually makes a DiGA so special? I read a McKinsey study that we have around 40 billion turnover on health apps in the world, but what is different if a health app is a DiGA or is not a DiGA?
Yes. So 40 billion or 40 million?
Billion.
Billion. Oh, and including fitness apps, I guess.
Exactly.
Yes. And that's the big thing. So I think most who are listening here are German, and we are really not used to invest into healthcare beyond our insurance card. So we have got a complete system. This is a regulated market run by by our insurance company, and we have got a great system. Yeah, so 50% of our GDP and increasing getting into healthcare, and for now you always have to convince the patient and the insurance company, and this is a really complex process if someone is buying your application and the other one is using it, and there's so many limitations when you have to convince both. With the DiGA, you have got the option to actually bypass the insurance companies because, like a pill provided from a pharmaceutical company, you can directly prescribe and get to the patient. And so no longer the insurance companies is deciding which digital health app you can access, but it's really for your personal patient journey. You can get the right app and you can really get access without discussing it again, the price and the usage and everything again with the insurance company. So there is a bottleneck. This is out of the picture.
Okay. So as a company, I see I have quite a big interest in becoming registered a DiGA because I will get reimbursed by the statutory health insurance. I know that you as CEO of Lindera have undergone this process, and so far they were saying that you would need to wait, that it is postponed because it's another difficult acronym called DiPA, which is the digital care app that you are getting classified next year. However, you are the big expert on the process as you've done it. Could you briefly let us know, first of all, what your company Lindera is about? It is a mobility analysis, and what then the DiPA is different to the DiGA.
Yes. And I've also prepared some figures so that we really have got the whole picture and discuss in depth. So also for Catherine, what can be an entrance door into the German system. So Lindera is specialized on 3D motion tracking through the normal smartphone camera. So for the first time, you have a simple app to do a motion assessment. So they are mandatory in elder care. They are mandatory in hospital before and after a hip or knee surgery. So all over, you are supposed to walk, and someone is thinking about, well, are you all right or not? Or so this is kind of the subjective process, or you do it in a gait laboratory with advanced cameras, and then you have got objective data. However, this is really cost intensive. So a gait laboratory costs you more than 40,000 euro, plus you need the space, you need the professionals, and it's really a hurdle. And you can imagine how many Parkinson patients you can bring to a gait laboratory and how many get back in a safe way. So we did this 3D motion tracking through the normal smartphone camera, and it's really precise. So we have got scientifically proven accuracy, so that we are really on the millimeter. And the first app we released on our tech stack is an app to analyze risk factors to prevent falls in age. We have released an SDK for healthcare and fitness apps, so they can automatically count and correct exercises. So your personal coach, when you do freeletics, when you do skill yoga or whatsoever. And the next app will be a Swift knife for assessments in hospitals.
So you underwent this process of being a DiGA and now being a DiPA. Does this mean this will be quite similar to being a DiGA, or don't you know yet?
Well, we do know. So So DiGA is based on the social law of number 5. And everything that's in elder care is number 11. So this is a big difference because one is a big healthcare budget and the other one is a limited elder care budget. That's a big difference, and that's a core separation within the German healthcare system. So DiGA is SGB 5. So the social contract of number 5, and here you can get a prescribed app that you can use on your own, 100% on your own. And so far we have got 15 listed DiGAs in Germany. There are 73 applications have been made there to the institution of BfArM, and 30 have pulled back. And 24 are in the current process. So 15 have made it so far. And this is the process for the digital health application. And they have newly introduced a digital elder care application. So the law is passed by the German Bundestag, but it always comes into action mid next year, so that there is a whole application process behind it. So that's under construction at the moment. And it was highly recommended that we, having a fall prevention app for seniors, go into the elder care section, because it's always helpful for people who are in need of care that they really have got some professionals around. So that's a big difference why we were shifted to the number 11.
Okay. Going back to Catherine's technology, this obviously would be then classified as a DiGA. And you already mentioned we have 15 companies so far on the list. And I looked it up. One is actually a migraine company, but I also saw that there are different companies with similar fields of indication. Catherine, does this make you uneasy that there is already a migraine app on the list?
Maybe a bit, and I think it's important that we have something that is better than state of the art. And I don't know all the details for the DiGA program, but I think it's very important that we use skilled consultants who know the process very well, and that we do all our background research prior to applying. So this is maybe what we are working on now, preparing, because we don't have the CE mark yet. So it will be very important for us to know all the details before we go into the process. But yes, it's of course, it matters. Yeah.
So maybe this is a good opportunity to Diana to give you some insights if she would be concerned if there's already another company, and of course, what's the homework that Catherine should do?
I wouldn't know a competition. I wouldn't worry much about the competition. Of course, you have to provide the right product for the right pricing, and convince kind of the physicians they think you are delivering the best evidences. It's totally marketing, as easy as it sounds. It's a total evidence game. So the best studies are paving the way to the physicians. I wouldn't be worried, not at all. And also, even though they're in one category, all products are a bit different, and all treatments. And having a variety, I would highly recommend to go there, to try it. The most important thing is to really start very early with the requirements, because being a medical product under MDR, so the new medical device regulation, is not sufficient. It's just the entrance ticket, but then you also have to fulfill all the DiGA requirements, and they are quite high. And the earlier you start, the better it is, because there is a reason why 15 are through, but more than double the number have pulled back the application. And it's not, even though DiGA sounds so kind of tiny and nice and so on, it's really a hard process.
Catherine, do you have a question for Diana?
Well, I'm still curious about the process, how to actually apply and everything, and if it's how will I know if it's worth it? And how will I know if DiGA is the right pathway, or if there's other good options in the German market? Hard questions to answer maybe, but I think it's very good to just hear your story and other stories to get a better perspective on how it works.
So that's really a very, very good question. I mean, within our association of digital health companies, that's kind of something we will discuss back and forth. Is it really sustainable and worthy to go the DiGA track? Is it possible to finance a company with all the everything you have to do under the medical device regulation, you need a position for regulatory affairs, for quality management, and so on. Is it sufficient to finance a company? We haven't got any proof points, and it's not clear, because even though in 1 month everyone is curious and you get a lot of prescription, and the next month it can be over because there's no security in it. However, I mean, pharma made a big deal on it. They have found a sustainable way to finance big companies. So I think it's definitely worth to be brave and try it out. However, you are totally right. Think about different pathways at the same time. And also, before you start into the market, why not going, so that's what we did, why not collaborating with the insurance companies for pilot projects so that you get your studies financed? And really finding out what else is possible, because the DiGA is one pathway with a doctor and not within a hospital, and really find your suitable setting in which you want to operate. And there are so Germany has got many settings before going to a hospital, doing home care, afterwards in rehab, and every setting has got its own rules and its own payments. And there get a clear plan where you might be a fit maybe now, or fit maybe at a later stage with more evidences, and where you are really solving problems for insurances and maybe for the doctor or for the patient, and really think it through from the different dimensions.
Thank you, Diana. I think this is very helpful. Thank you.
Diana mentioned, I think, one very important part, which is collaboration with insurance companies. I know that we also have international guests looking in, like Catherine, coming from Norway, from Sweden, or from Finland, wanting to do exactly the same thing. So this is something that I think we can recommend to anyone on the process, also to start early. Collaboration is, of course, nothing new. We always know that collaboration is important, maybe even more so in the digital health market, as it is that the companies are rather small. Could both of you let us know what kind of collaboration partners are most important for you, and which ones you might be even looking for? Catherine.
Yeah, so since we manufacture or design and develop sensor technology will be very important, and partners on the regulatory side of knowing everything on MDR and the regulatory process, partners who can help us into the DiGA program or get in touch with insurance companies. That would be interesting for us right now, at least. And other telehealth providers, maybe there are other interesting telehealth platforms that we can partner with. Yeah.
Diana, even though you're a lot further down the line as Catherine, but I would assume that collaboration partners is still an important part for you. Is there anyone, any organization that would be specifically important for you at your job right now?
Well, the complex thing is everybody is important. I mean, the healthcare system is like the United Nations. No one can pull something through, but when just one person has a veto, you have got a big problem. And even though it's totally regulated and based on law, it's a total network-driven system. and quite complex. When I mention the abbreviation of GBA to Kathleen, she won't have a total idea what it is. But the German healthcare system is not that run by the healthcare ministry, but more by the Gemeinsamer Bundesausschuss. Even if we would translate it in English, no one would know what this means. But this is kind of the big driving force behind it, and it's really, really crazy because they are not elected. They are in charge of the whole budget. Have never brought any digital thing through, except that they now do conference calls. I think that's the most digital thing they've ever done. And it's really crazy. So you really have to find a solution for everyone. And it's being persistent. Of course, the insurance companies are important. At the same time, in a digital world, patient data matters. So how to get access to the patient data. I mean, you can target them directly, but it's doing healthcare marketing via Google, Facebook, Instagram is... I wouldn't do that. Maybe it's worth a shot, but we go through the elder care system, for example, and have got big partners there. And it's always bringing all sides together, hearing to every kind of criticism and finding solutions, because really everyone can block you.
So when we look into the different participants when it comes to choosing a digital health technology, I think there's always the three areas. So we have the patient that needs to be willing to adopt it. We have the doctor who actually needs to want to prescribe it. And we need someone who's paying for it, which in Germany is the statutory health insurance. In Norway, that system works a little different. And by looking at those three parts, we also need to see how far are they, how likely they are innovative. And I was very intrigued in the talk that we had before to hear from Catherine differences of the systems. So Germany, we know we have family doctors, and most Germans that are listening in, they know how often they go there. And now even if we want to get vaccinated, we can get it at our GP. Catherine, just let us know how often you've been to a GP in your life.
Yeah, I think I told you, Cornelia, that I've only been a couple of times to my GP, and I don't know the name of that person. And there are certainly differences between the patient groups in the countries. And what I see here in Norway is an even higher willingness from the consumers to pay for health services by themselves, and especially for such digital health solutions that we will provide in the future. So it's all about getting to really know the users in each market, which can differ a lot. Yeah.
If you had both one wish free, that finding a partner, something that should happen, could you briefly say, maybe you have someone in the audience that actually says, yes, I can help with this?
I think in my case right now, it would probably be to find a pilot customer or a pilot program, something kind of like an accelerator program or export program into the German market, so that we can start in an easy way.
Diana, one wish for you.
One wish for you. Not sure whether someone can help here, but I think for Catherine and from my side, I really would love that the European Union is creating a common healthcare system. Not system in terms of that we insure it there, but for digital health solutions. We have got a medical device regulation, that's a European regulation. And nonetheless, now Austria has got its on top rules. You have got the different languages, you have got on top rules, even though there should be a common regulation. And that's really, let's call it a fuck up. And then we have got the medical device regulations, but on top, Catherine has come to Germany to do the whole DiGA process. For France, we have to do the whole look into Article 51. And every country has got its extra rules. And when you look at the latest news on Ada Health, Kaya Health, who has raised a lot of money, and it's always in there going to the US market. So Catherine...
unfortunately, I'm getting a little tight here on time.
Okay, sorry about that. Yeah.
No. So it is. I think a very important point that you're stating there. On a system level, Europe would gain big advantages if they would be able to merge things together and make a common approach. And for Catherine as such, of course, finding a partner. I know that there were questions in the chat and we talked with you before. Unfortunately, in this short format, it's not possible to answer them, but we would quickly want to show your contact information. So if anyone wants to reach out and ask Catherine or Diana something directly, please do so. And also, if you would like to get in contact with me, you can see my email, and I'm happy to get comments, or even you want to be my next guest. If we go away from the contacts, I want to thank you both for being such interesting guests. I think it was fantastic to get such insights to this very relevant topic. Thank you, Diana, and thank you, Catherine.
Thank you so much. This was very fun.
Thanks.
The next talk is a talk about digital care, and the topic is to see, is there more time for people in it? It is a special edition due to the German-wide Digital Day, Bundesweiter Digitaltag, and as such, it is the one exception that we do this in German. So unfortunately for our international guests, you might want to pick up some German before. Otherwise, please tune in. We have two great guests, Jasmina Barbian-Vogel, who is CEO of the Interkultureller Pflegedienst, and Alexandra Duesmann, who is CEO of a startup called Kind Care. See you soon. And if you want to register, the link is already in the chat. Bye-bye.